You are listening to the Horse Radio Network, part of the Equine Network family.
Hi everyone, this is the Ask Annie podcast, Horse Girl reviews on products you use. This segment is brought to you by Boehringer Ingelheim, makers of the ASERVO EQUIHALER. Dr. Steve Grubbs is the equine technical manager at Boehringer Ingelheim. Originally from Tennessee, Dr. Grubbs grew up breeding and showing quarter horses on his family's farm, worked with the Anheuser-Busch Clydesdales, and then attended Ross University and the University of Tennessee. He went on to work for 11 years in private practice before returning to graduate school and attaining a Ph.D. in comparative and experimental medicine, with an emphasis on virology and immunology. Dr. Grubbs now lives in Missouri with his wife and continues his research with BI in areas such as PPID and equine respiratory disease. Thank you for joining me today, Dr. Grubbs.
Well, thank you. Thank you for having me.
Of course.
Look forward to it.
So BI is heavily dedicated to continuing research in many areas of equine health, but you are currently involved in studying severe equine asthma. Can you fill us in on what equine asthma is and what causes it?
Yeah, and I think probably the biggest brief, and we'll probably get into some little detail a little bit later on, so I won't get started in the detail. Let's start big picture. And it is a respiratory, it's a non-infectious respiratory issue in horses, okay? And it's triggered, and really we say non-infectious, meaning there's no viral causes, there's no bacterial causes. And so we say, okay, well, why do they do that? And really the biggest reason why there's triggers. And what are these triggers? And the number one trigger is in the environment is dust, okay? In dust, whether that's outside, whether that's in a paddock, whether that's stall, but primarily when we're trying to manage these horses, we look at dust in the hay and dust in the bedding. And when that dust, and does it affect every horse? No. Okay. But the horses that are a little more prone and a little more sensitive to this type of dust, we get an increased inflammatory reaction in the lungs of these horses, which in turn, secondarily, they produce more mucus in there. So they'll cough some because of that mucus. They're trying to get that mucus out, right? And then second, they'll get, because as you go down in the horse's lungs, you have things called bronchi, just like in people, right? You've heard of bronchitis and that sort of thing in people. So then, but your bronchi is normally open to a normal size, whatever it is. Just think of a hose pipe out in the yard, or a water hose, out in the yard. Think of that. And it's just kind of there. Air moving really good. Mucus gets in the way. So now you get a little bit of decreased airflow because of the mucus, right? It's not tons of mucus, but a little in there. And it can be obstructive. So now, secondary to the mucus, we'll get what's called a bronchoconstriction. Now those bronchi may get smaller. So now we have less airway, or less air getting into the airway. And so it impedes the horse's respiratory system. So they're not able to breathe as well, exercise. And so we see things like that.
Yeah, and you really started to talk about it, but it is quite a problem for horses. Like why is it such a big problem?
Okay. And really one of the things when I just kind of mentioned it, when we look at, where we place horses, right? It's how we manage horses. And because the number one trigger is dust. And like I said, dust in the hay, in the bedding, and dust in, like I said, in their feed, whatever that is. And some of these horses, now a lot of horses could care less, right? You could put them on a dirt road, cars going by, no problems. But there are certain horses, it only takes a little bit exposure to hay, just dust and hay, that can set them off. Okay. And so with that, that's one of the reasons is the environment that sometimes we can put these horses in. Now, you can kind of see where I've kind of painted a picture of a horse in a stall, in a barn, that sort of thing, where a lot of horses are kept. But there's a lot of horses kept out in the pasture. And so there is a portion or a part of severe equine asthma out in the pasture. We call it summer pasture associated asthma. Okay. And so with that, then those horses will be affected while they're on pasture. There's no dust, it's what they're exposed to. And when I think of summer pasture associated asthma, then I tend to think of Gulf Coast. Okay, we think of Gulf Coast states. Now, can it occur in a lot of other states? Sure. Sure, it can. But I think we kind of come down. If I want to pick one state, and I'm not picking on Louisiana, love Louisiana, but you'll say, somebody says, pick a state, Louisiana. But, it's part of the environment. But you will see it in kind of those Gulf Coast southern type states. And you'll see it in other places too. But that's where a lot of that occurs. And so we manage those horses a little bit different in their environment.
How can horse owners recognize if their horse has equine asthma?
Okay. And so we start getting into a couple, and maybe I'll answer your direct question first, and then we'll probably move on because when we talk about equine asthma syndrome, there's a mild moderate, and that has a certain set of clinical signs. And then we have a severe asthma, which has another set of clinical signs. Okay. And so I think we were just talking about asthma. Let's lump those together for a minute. And we've got a non-infectious respiratory disease. And let's just say a horse owner, they're out riding their horses. Some may be, the only thing you may see is a decrease in performance, right? And meaning whether it's a ranch horse, whether it's a trail horse, whether it's somebody showing, the horse is in training, wherever it is, you may notice something's just off. And then another thing, you may notice these horses cough. Okay, they may cough. Now, somebody said, a lot of people say, well, my horse coughs once. Yeah, okay. But now, when my horse is warm enough, it's coughing a lot. Well, I have to ask, why is that horse coughing a lot while we're warming it up? Because if we're taking it out of barn situation, now, does it have a lot of that mucus? Okay, does it trying to cough up that mucus and get a clear airway? And then more toward the severe type, does my horse on occasion during I'm going to say for severe asthma, during it's episodic. It's not continuously all the time, severe itself. So severe, does my horse look good at times? And then all of a sudden, things start to bloom. Something has changed in my environment. Now my horse is maybe not coughing a little bit, but I notice my horse at rest breathing hard, okay? Or it's breathing harder than normal, maybe a little more depth, okay? And that's early on. Once they see it, they'll know it. And then, because we'll kind of get into that too, I'm sure. But, I think that's the things that I would look for because, if you take a horse's, if you look at a horse and you think it might have a little bit, if it's coughing some, and you might think it has a little bit of something respiratory, just, as a horse owner, and if they're used to taking the horse's temperature, if they do that and it's normal, because most, if not all of these horses, their temperature will be normal, right? And so because it's non-infectious related.
Wow, yeah. So what is the difference between mild, moderate asthma and severe equine asthma?
Okay. Yeah. I thought we might get there, but I just kind of lumped everything together to begin with. Now we can kind of sort it out. So mild, moderate asthma is probably a lot more, I'm going to use the term prevalent. Okay. We look at prevalence of the disease. Today, you go in and a lot of studies and a lot of work has been shown. It can affect anywhere, up to, 60 to 80% of horses in a barn. Okay. And so that's a lot, mild, moderate. Now, the thing about mild, moderate, what we said at rest, the respiratory effort's normal. They're not doing too much. They're just kind of hanging out doing what they normally do. And the thing about this mild moderate, horses of all ages can be affected. A lot of people will think, okay, it's more of the younger type horse. And I can probably lean toward that, okay? But it can affect older horses too. So when I think of mild moderate, because it's the environment. And the clinical signs we see are usually pretty subtle. Okay. And then, I mentioned poor performance. I mean, I think that's one, especially in some of these performance horses, these horses that are moving around, these horses that are traveling, these horses that are showing, because what are they continually doing? Going from barn to barn to barn, from city to city, from wherever. And so, maybe this kind of shavings at this time, most people take their own with them, but if they don't, they may get exposed to certain things. And then stalls being cleaned out all over the place all the time, things they can't control, right? And so, a lot of times it'll be, that little hacking cough too. And so, diagnostic, when we looked at those horses, we could tell the inflammatory uh, airway disease that's really going on within these horses, and then we kind of have to manage that horse that way. Now, we look at severe equine asthma. Whether that's barn associated, kind of what I've talked about, the dust associated with a barn, or some are pasture associated, those horses typically will have an increased respiratory effort at rest. When they're just standing there, that's not huge, but you can see it. It's kind of back in their flank, and they're trying to sometimes push that air out because they've got a little bit more mucus than they should. They may have a little bit more bronchoconstriction than they should. And let me say one thing about the mild and moderate. Some of those horses, whether they're very mild or up in the moderate stage, they can look a little bit different as far as whether their signs are very subtle or sort of subtle. Not very scientific, sort of subtle, but there's a range there. But the severes, they'll always have something, right? They'll have something that to move that, to show that they're really trying to breathe a little harder. And these horses typically affects horses greater than 7 years of age. Severe asthma does. Okay. Now, those horses frequently cough, right? And so they'll notice regardless, there's going to be some cough. Now, they're not sitting there coughing their head off, but some may. But a lot will just cough some, then you won't notice it for a little bit because they have a lot more mucus. They have a lot more bronchoconstriction. We call that airway obstruction because it is. I mean, it's just a kind of a term for airway obstruction. And then, and a lot of those horses are still utilized, right? Ranch horses, trail horses, show horses, right? They're performance horses. They're still utilized to some, to a lot of degrees, and they can be. But it's when they go through one of these episodes, when they've been exposed to a trigger and things start getting kind of fired up, that's what I'm going to call it, in their lungs, then they become a little bit exercise intolerant. Maybe they just can't go as much as they should have. And that might be a very early sign that we've got something there. Okay. And then because we just really have a more marked lower airway inflammation going on in those horses. And so, gosh, that's probably, really the bigger differences. And I guess I would say one more thing, because we get asked this question quite a bit sometimes. Mild, moderate. Do horses that have mild, moderate asthma, do they progress to severe as they get older? And I think that's a fair question. We don't have a good answer for that. Okay. And I think I'm really certain about saying this one. Okay. Is that not all horses that have the mild, moderate, the younger horses in the stall where they're exposed to dust, no, they all do not go to severe equine asthma. Could some of them? Maybe. That's a very, very long-term study. And I think that still hasn't been completely answered. Okay. But if I was a horse owner and somebody diagnosed my horse with mild, moderate asthma, and then I would say, and I'd read about asthma and I think about severe, I wouldn't lose sleep overnight thinking my horse is going to progress to severe. I would not. Okay. Because because a lot of times, and we can talk about, you talk about the course of disease, usually the mild, moderate, these signs may last for a month, because a lot of times we can get the environment controlled at that time or manage those horses. And then what we talked about severe, those signs are episodic, and they tend to get worse every time unless we manage it. And so we have to manage these horses ahead of time, and it's like anything else. We sit and talk about treatment, 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 treatment. The very first thing that I would want that I always had horse owners to do, which is the hardest thing in the world to do, is manage the environment. Okay. We have to manage the environment because if we don't, to some degree, right? Because depending on the environment, what you want to do or not do, right? And so, sometimes it can be real simple. If you've got a horse that's in the barn, it's barn associated, and you've got a little pasture, and it's no problem to turn the horse out, turn the horse out. Most of those horses get better pretty quick. If it's a horse out on the pasture and you can bring it in, then try and get a low dust environment in the barn as much as possible. Bring that horse inside. Sometimes it's as simple as that. Other times we have to do other management, and it depends on the place. We can throw a bunch of options out there, but before we get to that, one thing I would say about the mild moderate asthma is when we look at is there a genetic predisposition to that? That's not really been completely determined, but when we look at severe equine asthma, yeah, there is some genetics with that, depending on whether one of the parents have had it, the percent chance to foal will, or whether both have had it. It increases a little bit more. So that can be, because that kind of comes back to the immune system, the local immune system in the lung, right? And so that's going to be somewhat hereditary for that. But like I said, a lot of times it doesn't show up in these horses as severe until they're 7, and most of the time, a lot of these mild moderates is the environment. So regardless of either one, we want to kind of jump to the environment a little bit to help manage that. Because I'll say this, regardless of, this is my soapbox, I'm sorry, but regardless of whatever pharmaceutical treatment that we put with these horses, if we don't really make some effort at environmental changes, we're destined, I won't say we'll fail, but I would say we won't get the optimum response where we want. Okay. And because I would never say we would fail, because I think there's a lot of ways to do that. And people don't have to tear down a barn and completely do everything. There's little things that can make a huge difference. And so I think start out small with environment changes and move forward. Sorry. a lot of stuff,
That was awesome. And you did start on my next question, which was treatment options, and I definitely think you drove home the point that getting that environment right is the number one factor. But are there any other things that horse owners can do to treat it?
Yeah, I think first let's kind of just jump on environment, because I'm going to, with a horse owner, I'm going to say, okay, let's, because you're going to look at their particular situation, right? We're going to look at that and say, okay, this is what we've got. These are our options, because what one veterinarian may tell one farm or one barn may go to the next barn. It's not applicable. I've got to do something else because the environment's different. So I would caution any horse owner if says, well, my vet told me this. Well, the same vet told me that, yeah, it could be different because our environments are different. So expect that. Okay. Expect that. And so when I would look at that, like we said, if it's barn associated, whether it's mild, moderate, or severe, and you can turn the horse out, turn it out, if that's a possibility. If it's not, okay, then, a lot of times horses will be in runs, or they'll come out of stalls together, or however, and, round bales tend to be a no-no, because round bales, if you've ever seen, a lot of horses eat round bales, and it doesn't always happen this way, but the best hay in a round bale is right in the center, right? It's right in the center. And so they're going to eat that center out. I've seen horses, you can't see their ears because their head's inside that round bale, right? So what are they breathing? Dust, mold, anything that's in there, right? They're breathing all that in. So that's why we say no. Are there covers you can put over those to slow it down and stop that from happening? Sure. Because there are times, and see, that's where I would come up and say, not every suggestion or management change is going to fit every person, because someone may say, I can't store square bells. I have to use this. Okay, let's work with it, right? There's ways to do that. So you can get covers to put over them to keep those horses from doing that. They eat it slower, you know. It still will have some mold and things like that, but sometimes we have to deal with what we have, and that's fine. And then, you know, if they're feeding in hay nets, you know, hay net or hay racks or something up above the horse's head, just use your screwdriver, take those hay nets, take those hay racks down, take your hay nets down, feed the horse on the ground. You know, used to be a no, don't feed a horse on the ground because parasites or whatever else. Don't worry about that because you're in the stall. But uh, but the hay nets or the hay racks with the hay falling down, you know, on their face where they're breathing, right? There'll be 4 times higher exposure to all these particulates out of in that situation compared to being on the ground. So that's a simple thing we can do. And if they don't take the hay rack down, whatever, just throw it on the ground. Put it on the ground. Okay. And uh, and then if it's so severe and you have to get rid of hay, then you'd have to go to a complete pelleted diet. But most of the time, these horses can be managed. We can soak the hay. You know, we can wet the hay. We can wet it down, right? There's steamed hay, right? That people, it starts getting expensive when you're talking about steam. Unless you've got a barn and you've got a whole bunch of people have bought a steamer and you're working that together, right? And so then you can kind of work together. And it's not hard to do. It's pretty easy. You can, you know, if I can YouTube it and go out and see different kinds of steamers, they're pretty simple to use. Uh, and then, but like I said, the complete cubed or pelleted diet is an option if they need to. Like we said, soaking the hay and ground feeding hay. One thing that's used in like Europe, they'll feed silage, you know, grass silage to horses. We don't really do that much here, you know, because it's wet and it's moist. And there's things you have to watch about silage in horses, you know. We have to probably should think about somehow vaccinating those horses with botulism, but we don't really get to that point here. It's not that common, right? And uh, so it's just little things. I mean, it's, you know, think dust, where can I decrease it? And probably some of the other things, if you've got a bigger barn and leaf blowers, well, that's much, you know, everybody loves to use leaf blowers. I do, you know, but while the horse is in the barn, that's not a good thing, right? Because what are you doing? You're just blowing stuff everywhere. It's like a tornado going through there. And so turn the horses out. You know, if you need to sprinkle it down or just blow it out, give it time to settle down, then bring your horses back in. You know, if you store hay in the barn, it's best not to store it above the horses because over time it settles and it comes down. And so, and we come back to bedding. There's different types of bedding that people can use. I mean, some people use mats. Horses, I don't know. Kind of depends on if they go that route. You know, different kind of. You can buy different beddings. That's kind of less dust. Shavings is probably maybe better. Straw is kind of the worst. You know. For these types of horses. Now, if your horse is doing great on whatever you're doing, hey, don't change anything. But these are horses that are having problems that we try and manage that environment first, or at the same time that we start to use different products and things like that.
Yeah, it makes a lot of sense. So, BI offers a ASERVO EQUIHALER for severe asthma cases. What are some key functions of the ASERVO EQUIHALER that make it so practical and helpful for these very severe cases?
Yeah, and you said just kind of start from the beginning on this ASERVO EQUIHALER. You know, we talk about that. You look at, you know, when I think about ASERVO EQUIHALER, people can go out and you can Google it and find out what it looks like, and it's the product that's in it to me. Okay, that's number one, and it's called cyclesinide inhalation spray. What it is, I'm going to call it what it is, and then we'll give it all the other terms that people hear commonly. Glucocorticoid. It's a potent anti-inflammatory. Okay, what does all that mean? People have heard of corticosteroid. People have heard of steroids. We are not talking about anabolic type, not that kind of steroid thing. We're talking about anti-inflammatory, like in people prednisone. people say PRED, dexamethasone. I know people have heard that. Same kind of class of drugs. Now, to me, when I think about ASERVO EQUIHALER, the ASERVO, we talked about kind of the name a little bit earlier. But actually, before the podcast, we were talking about it. But we look at ASERVO, that's the product. That's the clesonide. Okay, that's the actual drug. The EQUIHALER is the actual, it's enclosed. It's an inhaled product. It's all in one. It's easy to use. And probably the biggest thing about it is that it is locally administered. It's administered nasally, intranasal. Okay, the horse breathes it in. He goes straight to the lung. That's where the issue is. Now, one thing I'll back up and say about ciclesonide, it was approved. Boy, somebody might catch me on the year. It was either 2008 or 2010. Ciclesonide was approved in people. And why did they approve it in people? Was because of the safety of this product compared to other corticosteroids. And because every that I know of, because if you take, one of these puffers or whatever a person takes, utilizes, if they have different corticosteroids in them, glucocorticoids, kind of the same thing. As they puff that, it's active right then. Okay. So meaning they're absorbing that as soon as it hits the back of their throat, the pharynx. Okay. So they're absorbing that. And so now they've got systemic absorption and it's absorbed all over the body. Lung too, but everywhere else. And so ciclesonide is not absorbed like that or minimal. And ciclesonide itself is has very little activity because once it's inhaled, ciclesonide is changed by the body to a product called desciclesonide. And the potency ramps up tremendously, okay, but in the lung, not in the pharynx. And so with people, it was the same way because with all these others that had active drug being absorbed, they were getting oral ulcers, oral infections, fungal infections in their mouth. If it was young kids, you had to worry about bone growth because you were getting systemic absorption. So they brought ciclesonide out because it's activated in the lung. And so they minimized all these oral problems, and they could use it in younger kids, right? So same thing in horses. It's activated. It's very inactive when they inhale it, but it's activated in the lung. And so with that, you get very little systemic exposure. I won't say none because that wouldn't be true because there's it's possible, but it's minimal through there. So I think the efficacy and the safety go along with that. So it's the way the EQUIHALER is formatted. It's one hand that has everything in it, and there's some instructions how to do it. It's hard to talk about without seeing it in front of you, right? But it's an intranasal, goes in the left nostril, and it just puffs. And it's a dry mist. It doesn't shoot out like if someone's using one of the inhalers for people who are hitching the back of the throat and it feel like, it's tough when that happens. And so, but horses, it's a very soft mist. It's very slow moving. And as the horse breathes, it breathes this soft mist in and then deposits it deeper into the lung because the particle size needs to be extremely small to get to the lung. And we call that less than 5 microns. Okay. And so that's what we're looking at with this product because that's the same size as a lot of these dusts that get to the lung. It's less than 5 microns. It's not these big pieces of stuff that you see when you walk through a barn and you see sun going through and all the dust in it. I don't know if you've ever seen pictures. That's probably not the stuff that's getting deep in the lung. That's going to get higher up in the pharynx, but not deep. It's the stuff you can't see. And that's the way this is, that mist. And so it gets deep in the lung because it's such a small product and it's activated there. And so really, we've really like the safety of this product and, the efficacy.
Oh, yeah, and really it's like the administration of the product and then the actual composition of the mist that seemed to make it so successful.
Right. And basically what we are treating is the lung, right?
Mm-hmm.
Because with others, even though we're giving it in the lung, they are being systemically absorbed. So they have systemic effects on other parts of the body. For example, a lot of people may not know this, but at times, there's some studies out there that's actually done in Canada where this has nothing to do with the servo, but it's talking about steroids and systemic. Horses will get maybe a joint flare or just a little bit of wear and tear, so they'll inject something into like a knee or something, a carpus in the front, and which is completely fine, and they'll do that, but then their lungs will get better. They'll start feeling better, and they're only injected into the joint. Well, when they inject into the joint, it's systemically absorbed enough to kind of help the lungs too. Well, when we give seclesonide, it's not going to help any other part of the body, right? Because it's staying in the lung. That's where we want it to be. And so we kind of like that part of it. So yeah.
Yeah. What makes a horse a good candidate for a servo equihaler?
Okay. I think when we look at that, but I think when we've got equine asthma and you've got a horse with severe equine asthma, and I'll always say this, environment first or environment at the same time. But then if I can't catch the horse very well every day, probably not a good candidate. And if a horse is extremely head shy and I can't do anything with it, probably not a good candidate. But other than that, I can't really think of much, that would say no. I think horses that are good candidates, actually, with the disease, because even at first, regardless if a horse, because, it'll take just a second, and there's videos out there on YouTube. We've just created another one. We've got one of our territory managers down in Florida. She worked with one of her folks and had a crew put together to create a video, and she did a really good job to kind of show what's called we have 3 steps called Pierce Prime Puff. And I won't say any more about it because we don't have one of the little the ASERVO EQUIHALERs to actually show. We can't show it on a podcast. But if you look at the picture, if you go out, somebody goes out and Googles it, they can look at it and see that. And there's only 3 steps. And, horses, at first, because it goes right in the edge of the nose, right? And at first, if a horse is like, what are you doing? So we kind of had to get a horse used to it. But most horses have either, had a stomach tube or something, and most horses tolerate that. It's not that big a deal. And then once we start to treat them, it's kind of interesting how horses figure things out that after they've been treated, they think, I can breathe better. They do, they'll come to you. It's like, I can breathe better now with this. And so it improves every time. So, so with that, yeah.
Wow. So if a listener thinks that their horse might have equine asthma, what sort of questions should they ask their veterinarian?
Yeah, I think, one of the things to just kind of, if they think asthma, now, one thing we didn't touch on, equine asthma syndrome is a little bit of a new term. Okay, I'm going to say new. It's maybe to the public. We've called mild moderate asthma inflammatory airway disease for years. It's still called inflammatory airway disease. Okay, and so when we talk about severe equine asthma, we have called HEAVS. Okay, everybody kind of understands now what we're talking about. HEAVS. It's called other names. So there's 1,000 different names, but I think to kind of get used to those because there are differences in horses, how they respond, just like people with asthma. Certain products work for most people, but if there's probably some certain classifications that folks are trying to sort out now in horses, that may not respond as well to typical treatments. So anyway, back to that. So yeah, and I think the first thing is just kind of look at their horse and get a little bit of think of the parameter, think of what, is there something off with their horse? And, they can look at the horse and say, is he breathing hard standing here? No, probably not. Or if he is, then, and that's before you ride him or something like that. If they see those things and they can think, and then they can, speak to their veterinarian and, about what they're seeing, or if it's maybe poor performance. And then, gosh, that can be divided into so many things. But, what does that actually mean, poor performance? And I think to try and gather a little information, is the horse just not cooling down fast enough? Is it, after riding, is it taking a lot more time for that horse to cool down to, that sort of thing? And I, I think probably the biggest thing, the questions would be then have the veterinarian take a look, right? Because some of these horses can be diagnosed without a lot of diagnostics, especially the severe asthma horses, sometimes the inflammatory airway disease, occasionally, mild, moderate asthma. Here I go. Uh, sometimes we need to do a little bit of diagnostics, or sometimes then as veterinarians we'll kind of treat and look at the response, because a lot of times we can listen to their lungs, we can listen to their trachea, and there's certain specific sounds we can hear, and to help us with the diagnosis with that. Then we start managing, and then as a veterinarian I'm going to look around and I'm going to ask the horse owner to let's walk, let's walk and talk, and let's look at your environment here. What can we do with this horse? This horse is in the middle of the barn. Should we move it out toward the end? Should we, we clean the stalls? Let's just talk about a few little things that we can tweak. We don't have to change too much, And then let's just say if the veterinarian puts their horse on, say, a ASERVO EQUIHALER, right? They decide that they prescribe that. One thing I always, as a veterinarian, when I'm talking to horse owners, I want to tell them kind of what I think to expect, how this horse should improve, because that'll be different for everyone, because every horse could be a little less severe, a little more severe. So sometimes it takes a little longer, a little less. But then I'm also going to say, okay, regardless of what we're doing, just like if we're vaccinating the horse, could there be a side effect? Sure. And so I think that's something I always told horse owners. But if you see this, call me. Let's talk about it. May not be anything, but call me. So when we look at a ASERVO EQUIHALER, one thing, just because studies haven't been done, we hadn't evaluated it in pregnant, or lactating mares. And when we did the efficacy studies in a large number of horses, and the efficacy studies were actually done in the U.S. and in Europe. So this is a globally approved product. It's not probably approved in every country in the world, but in the bigger countries it is. Okay. And so the most common, let's just say, an adverse reaction that was reported to us, the horse may, and you may laugh at me and I say this, but coughing, some nasal discharge, the horses may have sneezed, and they might have had a little bit of nasal irritation. That was the things that were really reported. So I think that's something I would always tell horse owners, because more if I hear coughing, okay, is that due to the ASERVO, or is that because we're not controlling the disease just yet? Same thing with the nasal discharge, because you can see some with that mucus, occasionally with the disease, and then sneezing, is this horse just not like the thing in his nose, that sort of thing. So I always tell people, here's what to look for. If you got this, call me, let's talk about it. And sometimes it's not anything I have to deal with, but and then probably always tell anybody, this product is not for use in humans, and keep it away from your children. They don't need to be playing with it. But it is another product with a different amount of product in it is approved for humans, but don't use it.
Okay. Yeah, makes sense.
Yeah.
So jumping back into your personal experience, we briefly noted in the introduction of the episode that you went to vet school and then established a private practice and then decided to go back and get your Ph.D. Why did you decide to alter your career course?
Yeah, I question that a lot. You're not the only one that questioned that. No, actually, I went back and did a, it's not in there. I did a medicine residency, internal medicine. So I got boarded in internal medicine, large animal. And during that time, and all right, to answer your question, why I went back, I was in practice. And of course, there are questions come up that you can't answer in practice. You've been taught everything under the sun. You go to continuing education, you look and you sit back and scratch your head a little bit. So maybe I just wasn't satisfied. I don't know what. Yeah, that was it. I wanted to know a little bit more. I wanted to understand a little bit more. And is there something else we can do? And it was just a starting point. So the residency was the starting point. And to be honest, when I got to the residency, I thought, okay, I'm going back to practice. But during the residency, I got involved in clinical studies, clinical trials, clinical research. So I said, nope, I'm not going back. I'm going in. And then I was fortunate enough to get in to do a Ph.D. And I was a little older. I'd been out in practice, did a residency. Now I'm in a Ph.D. program. And you take biochem with folks that are 20 and they've got a master's in biochem. That's a little scary. And so that'd wake you up a little bit. But it's fun. We had a good time. Enjoyed it. And so I think that was the reason. I wanted to know more. I wanted to be able to probably try and do more. And I think the PhD itself taught me more about research. It taught me more about what we call scientific method, okay? Kind of how to do something and really evaluate something and look at it and not just, and I didn't want to answer big questions. I didn't want to understand how we get to the moon or anything. I wanted to understand little things, practical, that we could do and do research. And then we can make a difference to some degree with some way with veterinarians and horse owners the next week, that sort of thing, And so that was the driving force, and it still is, it still is, because I love practice. It was hard to leave, and I had a lot of crossroads at times where I thought, should I stay? Should I go back? And I stayed, and I'm glad I did. Still miss it. Still miss the horses, miss the people, miss the clients, and but still love what I do.
Yeah. Why do you see research as being so critical to the success of the equine industry?
Well, I think we have to keep looking, right? I think we have to keep, is there something better? There's great treatments, because every time we look for maybe a new product or a new way to treat something, we find ways to help manage those horses. It doesn't cost anything, a little effort, right? And so as we do that, we just keep moving forward, because I don't know, I'm never one to accept what we have for horses, for what, not to get gooey, but for as much as horses have done, for us, right? Then why stand around and accept what we have? I think we should continue to keep looking forward, keep being eager and not satisfied with what we have. Be thankful for what we had, but is there something better? Is there something better we can do? And there's a lot of places, we still think we can improve, and but it's slow. Clinical research is slower than we want, but you just kind of have to jump in it, stay in it, and do something to move forward every day with it, and we'll get there. So, yeah.
Yes. Speaking of growth, are there any new products on the horizon from BI that listeners should keep an eye out for?
Yes. Now, I can't finish that because I can't say, because of I can just always answer, because that's one thing I've loved about BI is we've not kind of, I knew that before I came here. They just didn't sit. They didn't sit, and they weren't happy. They weren't just sitting happy with what they had. It's kind of like, what else can we do? And, so yeah, I think there are some things. Some are, again, slower than others. Some I would love to have had yesterday that I think there's a huge need. And I push every day, and I push people that are working with it every day, and so yeah, there are. I mean, more than one on the equine side. I can't speak for too much other divisions, where the cattle and that sort of thing. I'm not really as much involved in that, but on the equine side, yeah, it's never as fast as we want, but I think we just stay in it and keep after it. We'll get there. So I'm excited. I'm excited for the future, for some things, for the horse, and for the horse owner and everything. I think there's some good things.
Thanks for tuning in.
Learn more about the Ask Annie podcast by following us on Facebook, Instagram, and Pinterest at Ask Annie Podcast. Have a suggestion for a product you'd like me to use in an upcoming episode? Email me at askanniepodcast@gmail.com or leave a comment on any of our social media pages. Find even more Ask Annie episodes anywhere you listen to podcasts, including Apple Podcasts, Spotify, and many more. The Ask Annie podcast is a production of the Equine Podcast Network, an entity of Equine Network, LLC.